So I think we could get started.
Well, good morning, everyone. It's such a pleasure to see you all today. I'd like to welcome you to our Senior Issues Group workshop. If you are, we see a lot of familiar faces, so we thank you for those that are returning to participate in our workshops. And for those, this is your first time, welcome. Ten at the Top has presented or organized these workshops for the past year and a half, maybe 2 years. Last year, we had very successful workshops in discussing those issues surrounding seniors. We've talked about transportation, meals, aging in place, so living at home, as well as senior housing. And we did not want the pandemic to stop us from continue to have these discussions. So we want to continue to have their discussions, and here we are today with our another workshop discussing issues surrounding our seniors. We have an awesome agenda to hear for you today, but today could not be possible without the help and the support of our sponsors. And I have been blessed and fortunate to not only be a member of 10 at the Top, but also to be a sponsor today. And then we also have another sponsor, which is the Better Business Bureau. I'll just tell you a little bit about our company. We're a home care agency. We have been in business since 2011, where our goal is simply to provide exceptional care and peace of mind to the families. We just want to make sure our clients are getting the help they need on a daily basis to help them age in place with dignity and grace. So it's just a pleasure to be here today and to help the seniors in our area. Our other supporting sponsor is the Better Business Bureau, and we have V here, who is the president and CEO of the BBB, and she will come and talk a little about, she'll talk about the Better Business Bureau as well as to introduce today's featured speaker. During the featured speaker's time, when she is finished, there will be a time period where we can have questions and answers. So if you want to submit your questions rather, please use the chat feature in the Zoom uh, platform, and I'll rely on Justine to help us to get those questions to Ms. Emma so she can answer those questions. And then once the featured speaker has completed, I'll come back with the further go over the further agenda. So at this time, I will turn it over to V. She can talk about the Better Business Bureau as well as introduce today's speaker. So V.
Good morning and thanks, James. Um, it's definitely a pleasure to be able to present our speaker today and thrilled to see all those in attendance on the Zoom meeting. And all of us working together can definitely make strides with tackling our senior issues, not only here in the upstate, but within our great state of South Carolina. Our speaker today, Emma McGraw-Myers Bailey of Columbia, serves as the state president of AARP South Carolina. Emma is the Chief Operating Officer of the Advanced Care Management, which employs case managers statewide to conduct assessments, develop service plans, and provide care coordination to the elderly and disabled on Medicaid. She is also the president and CEO of EM's Consultants, a Midlands-based small business specializing in fundraising, training, and building for corporate faith-based and grassroots organizations. Emma is one of the largest serving adjunct professors at the USC College of Social Work, and she's been active with the AARP South Carolina for more than 10 years as a multicultural volunteer, and most recently as a member of the Executive Council. She has an opportunity to witness the organization's impact of quality of life for the 50-plus population of South Carolina. And as state president, Emma plans to bring her experience and community connections with partnerships with the AARP South Carolina staff to move the organization to the next level of changing the lives of those 50-plus individuals they serve. AARP South Carolina represents more than 600,000 people, and that makes AARP South Carolina a force to be reckoned with, especially when it comes to mobilizing members to advocate for issues related to financial security, government accountability, utility reform, senior hunger, and of course, my favorite, family caregiving. Myers holds a Bachelor of Arts degree in social work and a master's degree in social Social Work Administration from the Florida State University. She is married to a retired brigadier general, very, very impressive, and they have 4 adult children. She's a member of First Nazareth Baptist Church in Columbia, and active in a lot of social civic groups and community initiatives in Columbia and the Forest Acres. Meyer is a 46-year Silver Star and live member of the Alpha Kappa Alpha sorority. With no further ado, please welcome today's speaker, Emma McGraw Myers-Bailey.
Thank you now.
Yes.
We can
Oh,
hear you. Yes, we hear you.
okay. Is that any better?
Yes.
That's
Yes,
great.
All righty then. Okay. Sometimes we can fix it. Doreen, thank you for being willing to punch and shuffle. Okay. Can you go back to the first slide, Justine, please? Can you go? Yes. All right. Now, can you go back one more?
Here we go.
Okay. All right. So we've done that. Can you go to the next one?
Yep.
Okay. And now the next one.
Yep.
Okay. All right. Here we go. So does anybody recognize what that might be?
Looks like an outhouse.
It's like an outhouse. Yeah.
How about a chicken coop?
That sounds
So, so our founder discovered one of her colleagues was living in a chicken coop as a result of not being able to afford health care.
Wow.
And she was so outraged that she then went on to become an advocate for seniors and for health care and for the rights of those who are 50 and above. This has grown from being in one state now into being into 50 states. Please fast forward. Please, next slide. Yes. So now AARP today is considered a premier organization for those 50 and above. And as you can see here, this is this little old lady. Can't you just see her now? Former school teacher telling everybody from presidents on down that we need to be concerned about the health care and welfare of those of our seniors and to be able to protect them. Next slide. We now have AARP in South Carolina is located in Columbia in the downtown area. There's a small core staff of about 9 people. And then of course there are volunteers that we have a record of over 600,000 as V mentioned in her introduction. We have 2 affiliated entities. One is considered a foundation, which you will hear a lot about in terms of some of the kinds of things and financial support that they are able to make. And then there are the organizations such as the services. And those are the ones where you see the products and you also hear about the benefits and, you know, those are the ones that are asking you about insurance. Next slide, please. AARP is a nonprofit, nonpartisan organization, and our mission is to help improve the quality of life for those 50 and above and their families. And, you know, we're known for the red and white, and you might see those t-shirts with any number of kinds of things on them. We are a 501c4. Next slide, please. So what does it mean when we say that we're nonpartisan? When we stand for issues that affect the seniors, we do not endorse candidates, we do not give fundings for candidates, but we do create forums and opportunities where we get to discuss what are their views on Medicare, what are their views on caregiving. And we've done a number of things. We've had a tremendous impact because research shows that seniors, if nobody else, votes. Next slide, please. Okay, so let's talk about some of the areas that AARP has a presence in. When it comes to health security, I heard V said that she's involved in, or she's concerned about what's going on with caregiving support. We do believe in providing activities and information that promote independence and the dignity of our seniors. We believe in trying to make sure that seniors are resilient and that they are able to plan for their future. We want to protect, of course, Medicaid and Medicare and Social Security. We want to try to look at how we prevent fraud. I have a 92-year-old uncle that I am caregiving for long distance in the big city of Hartsville. And when I'm with him every weekend, it never fails. He gets anywhere from 5 to 10 calls from people who are interested in ways that they can help him. All he needs to do is to give them his Social Security number. He needs to give them or his bank account number, and it becomes a real challenge to how do we keep that from happening to seniors who have lost literally hundreds of thousands of dollars. We also believe in livable communities. We believe that if a community is livable, that means that it is park friendly, the sidewalks are accessible, and they don't have humps in them so that people are tripping over them and falling. That it's good not just for our seniors, but for everyone. We try to promote and educate people. While it is not unheard of to have affordable and accessible housing. We are also concerned about transportation options because as we age, we do not necessarily have access to our own private transportation, and we need to talk about how do we have an age-friendly network. Next slide, please. Okay, so with that background or backdrop, then let's talk about COVID-19 and its impact and AARP's response. Next slide. Okay, so as we talk about COVID-19, we know that many of our seniors, and perhaps a few of us on this call, may be challenged with such issues as hypertension, some have obesity, some have congested heart failure, and the list goes on and on. So because of our health challenges, we therefore then are in a position where we need to be aware that COVID-19 doesn't discriminate when it comes to age, but it does discriminate when it comes to our, and I'm changing my sound here because wouldn't you know it, my lawn service just arrived. So in the background, there's some things going on. Okay, so because COVID-19 does not discriminate, we have found that our population is having severe health outcomes. They are relying on others to come in and provide caregiving, and this is presenting some caregiving challenges. We are hearing from many of our members that they are feeling, because we've been encouraged to do social distancing and quarantine, that it is then translating into social isolation. Places that seniors normally go, which would be parks, recreational facilities, whether they would go to libraries, many of them are closed and remain closed. We also have the financial impacts that comes from COVID-19. And when we say the coronavirus has impacts, they have made some accommodations for seniors in that many businesses have opened before hours to allow us to come in and to access resources. But in addition to that, there's the issues of food insecurity. So consequently, we have people who are experiencing not having food. Now, it seems like we are pretty much at a tipping point, and that tipping point is that now we have groups that are providing boxes of food and deliveries and giveaways. And so now we are at a point where some seniors have so much that they can't accept anymore. And there are still other pockets of the community that are not getting anything. So COVID-19 is definitely having an impact on our population. Next slide. AARP has found, because as we were talking at the beginning of the session, that we are not having any in-person meetings. All in-person meetings have been postponed or canceled through the end of this year, and we will revisit it at the first of the year. That includes the offices and any gatherings. We have now had to rely on technology. And some of the things that we have done is that we have tried to educate our members about what does this mean, and we have tried to encourage them to still continue to be active as advocates. And so these are just 2 slides of what we call teletown halls, where we've talked about how COVID is having an impact on communities. And we've had anywhere from, I think the smallest turnout that we've had is we've had about 5,000 people on a call, and it has gone up to 30,000 people have called in to participate in our teletown halls. Next slide, please. So far, we have had 7 sessions. Some of the topics have included health disparities, mental health, and of course, financial security. Next slide, please. We have written a letter. We've written more than one letter. We've written several letters to the governor, but the result has been of one of our first letters that we wrote about the CARES Act spending is that the governor has agreed to expand internet, high-speed internet to populations, particularly rural populations. And this has become tremendously important now that school is going back, because so many of our young people are living in areas that instead of being a food desert is an internet desert. We also have gotten a response from him about following up with the nursing homes in terms of their infections and getting some actual reports now on the deaths of persons who are in nursing homes. The last number that I heard, and Mr. Bennett, you may be familiar with this because you're also in this industry as we are, that it was as many as 40% of the deaths in South Carolina have been tied back to nursing homes. We have also written to the governor about how we can do safe voting, and we have asked and was approved that people could vote absentee in the June primaries with no excuse. Now, we have not been successful to make that happen for the November elections, but that is certainly on our radar. And lastly, we are looking at establishing an office for diversity, equity, and inclusion that the governor has agreed that that would be established at DHEC. Next slide. We also are finding that people are at home, and if they are not suffering from quarantine fatigue, they are now beginning to suffer from Zoom and other kinds of virtual overload. But we still realize that it's so very important to reach our members, and we reach them with information. AARP South Carolina produces a bi-weekly newsletter, and in that newsletter, it comes out every other week, that is, and you can, of course, subscribe to this if you would like, where we talk about just some of the upcoming issues and key things. It's generally no more than a one-page piece. Here's a picture of it here. Now, we also have done virtual events, and we are looking at doing, we have done and will continue to do some workshops on fraud and caregiving. We are so proud that we have 16 chapters, AARP chapters around the state, and we held a virtual summit. It was done in 4 parts, and we had excellent participation where we shared information. We are also planning now to do some Zumba classes, some Tai Chi classes, and also we will be launching a book club. And a book club is about social justice, where we'll be reading the book Just Mercy. So stay tuned, everyone. Next slide, please. Okay, now here in the upstate, next slide. We are so pleased that we have of our 10-member executive council, that is the oversight committee that I am a part of, and I serve as the state president for AARP, but I also have this 10-member delegation, or I should say committee, and our executive council members, we refer to them as the EC, our executive council members come from all around the state. And we're so pleased that representing the Greenville area is Dr. Annette Christie, who is a retired, I think they call them media specialist. Back in the day, we knew them as librarian, and she is out of Easley. And she, of course, meets with us when we meet 4 or 5 times a year. We are also excited that Dr. Evelyn Lugo out of Greenville will also be coming on board with us in January. So we try to have a core of about 50 or more active legislative volunteers. Here's a list of our chapters. I would guess that some of you are members of our chapter. We are so proud of them. They are very active. Prior to COVID-19, in addition to doing services, some of them were known to take trips. And of course, they also partner with some of your organizations to make things happen. As far as the community goes, we are pleased to be partners with the Greenville Better Business Bureau, with the United Way of Greenville, and the list goes on. We also offer pretty much every year through AARP National, which is located in Washington, that we offer what we call community challenge grants. And 2 grants have been awarded in the Greenville area or the upstate area. One is the Mill Community Ministries and the Greenville County Parks and Recreation. Next slide, please. So, having talked about AARP, that we are more than insurance and discounts, that we are really about advocacy for seniors and their families, seniors 50 plus and their families. We talked a little bit about how COVID-19 has disproportionately affected our volunteers and our members. And we've also talked about some of the things that we've done in the upstate, which we have just shared with you. So having said that, Justine, Mr. Bennett, we are, I would certainly like to ask if there are any questions, any comments. I did see a couple of things in chat, so please have at us.
I have one to start out. I was thinking about how would someone go about starting a chapter in their city or town?
Okay, all righty. It would begin with, do you see that person listed there, Cherie, on the screen?
Yes.
And they would merely give her a call, and she would walk them through all of the steps, and would be more than happy to accommodate them. And her name again is Cherie, and this is her direct phone number, 803-403-5071. Now, if a person would like to, they could go to aarp.org/SC to get information about starting a chapter in South Carolina.
Thank you. I have one from Dean. He's asking, does AARP have any initiatives in South Carolina that support transportation for seniors?
Yes, we have funded. It's an excellent question. We are concerned about transportation, and transportation has many tentacles, should I say. It is not only transportation of how you get a person from their home to a medical facility or to a doctor's office, a pharmacy, or another kind of appointment. Our transportation is how do you get people to essential services like particularly persons that are in rural outlying communities. How do you get them to there? We have done some funding where we have directed some grants. We have EC members who have put in proposals. We have another EC member that serves on a transportation committee in the, let's see, he is in the Myrtle Beach area. And so we do have people who are concerned about transportation. And what I would say is that I think it would make sense to put Dean in touch with, some of those individuals, and I'll be happy to do that. I'll be happy to broker that to be able to talk about some other very specific things that we're doing in transportation. Now, of course, as I'm speaking about AARP statewide. And so as we talk about things statewide, the laundry list is long. And I have opted not to try to be involved in everything. I have some passions. I came into AARP because my mother was diagnosed with Alzheimer's. And as a result of that, I became very passionate about what goes on with caregivers and the isolation that they feel and the frustration and the challenges. And AARP, of course, has so many resources. We also have volunteers who can talk to people who may feel isolated. It's called the Friendly Voice that AARP offers nationally to people. If you just need to talk to somebody, you can call that number and hear a voice as opposed to a recording.
Oh, that's so great. That's amazing. I can't believe I've not heard of that before.
Yes.
James, did you have some?
No, I was going to state that we have another question from Maria. Says, are you still having your town hall meetings?
Yes, we do. There is not one scheduled between now and I think because of Labor Day, but we do have some town hall meetings. And Mr. Bennett, will you be the contact, or should I send the next one upcoming to you and Justine that you can share with your members?
It may be best if you can share that information with Justine and she can send
Okay.
the information out to everyone that's on the call today.
All right.
Great.
Sounds good. Okay. And it's no charge. It's no charge for the teletown halls. And they generally last an hour. You do not have, all of the teletown halls that I have participated in so far, there is just a picture like of the speakers or the panelists. And we've had an impressive list of panelists, including our governor, our state epidemiologist, and a host of other persons, mental health specialists who've been on. And so there's no charge to participate, and you don't have to have Zoom. You can actually call in and listen just as other people would do so.
Mm-hmm. Okay, very good. There's a question from Miss Peggy Baxter. I'm not quite sure. The question says, Mills Community Ministries was what was funded?
Yes.
Okay.
Yes, that means
Maybe,
that
okay.
AARP did a community challenge grant. And Ms. Baxter, if you want to unmute and share with the your colleagues here what you guys got that funding to do.
I've asked her to unmute, but I'm not
Okay.
seeing her come up.
Okay.
Oh,
All right.
here she goes. Oh.
Okay. All right. She unmuted her screen. Now she just needs to hit her mic. Ms. Baxter, go ahead and brag. This is your moment now. We don't have many moments in life, but this one is yours. Can you tap your little red microphone there?
Can you hear me?
Yes. Yes, we can hear
Okay,
you.
I can't brag. My question is, what did you fund Mills Community Ministries to do?
Oh, okay. It was a challenge grant, and I don't have all the details, and that's why I was hoping you could fill it in. I can. South Carolina received 6 grants. We had 30 applicants, and the national office selected the ones that would be funded. But if you will, I'm learning how to be creative here. So I'm going to see while I'm looking, if someone has another question, I'm going to look and see if I can find what they specifically funded them for. Okay.
Okay.
So
Very
so
good. There is another question, Ms. Myers, about
yes.
Is there any initiative taking place with AARP about immunization like flu and other immunizations that are needed for seniors?
AARP has not made provisions for immunizations. What they have done is they have supported initiatives to encourage people to get the COVID-19 testing. We have also encouraged our members to consult with their healthcare professionals about what is in their best interest. But in terms of AARP actually offering, immunizations and so forth, we are not. What AARP's position would be is that we would go with a partner. For example, we would partner with the hospital that you all have there. Used to have a different name. It's now Prisma Health. Is that right, in the Greenville area?
Correct. That's correct.
Yes. AARP would approach Prisma Health with the concern that there are a number of seniors who might be being missed because you brought it to our attention. But we wouldn't do any more than that other than to put it on their radar screen. Does that make sense?
Yes, ma'am, it does. It does.
Yes. We wouldn't actually do the vaccinations, but we're hoping that people will not hesitate to get vaccinated. This is a virus that we don't seem to know a lot about. And this is also a virus that seems to be morphing. Would you kind of say that's what our experience has been? I'm sure you're having some of the same.
Yes, ma'am. Yes, ma'am. We'll just have one last comment, I believe, from Andrea Smith. Maybe she has received funding from you all and like to share what they're doing. So Andrea, if you can unmute yourself and share what you'd like to share with the group.
Thanks, James. Yeah, we were one of the recipients of the funding that Emma's talking about. Many of you probably know that we partner with the Greenville County Parks and Recreation Department for our center that's in the Berea community. And we opened that center in August last year, and it has had huge, overwhelming response, hundreds and hundreds of people. Unfortunately, we did have to close it in March, but we've been serving meals in the parking lot there ever since. But the grant that we wrote to AARP was for developing the outdoor area. There's a very large grassy area right next to the building. And so we wrote a grant, got some assistance in designing an outdoor space. So the outdoor space includes walking path, raised gardens, benches, just a really nice outdoor area for seniors to be able to come to that center and enjoy outdoor area, exercise, social opportunities, etc. And so we were really, really happy and excited that we were recipients of that funding. And we can't wait to get started working on that project.
That's exciting. Thank you, Andrea, for coming to my rescue here. I do
So
have
just a question, Andrea, is that the program that's listed at Greenville County Parks and Rec?
No, that's different.
That is correct. It's listed as Greenville County Parks and Rec because they were the actual receivers of the money.
Okay.
But that's a senior action partnership.
Great,
So
thank you.
The Greenville Parks and Recreation and Tourism is the one to be used to equip an outdoor space at a community park with swings, benches, gardens, shade structure, a walking path, and a horseshoe pit. The Mills Community Ministry will help combat food insecurity by expanding its capacity to distribute healthy, affordable food to vulnerable older residents. So Upstate received the 2 grants. Columbia is another recipient. Myrtle Beach received one related to livable communities, and Somerville also received a grant. And these grants can range anywhere from a couple of $1,000s to upwards of about $15,000 to $20,000. And this comes not from AARP South Carolina. This comes from AARP National.
Oh,
Thank you, appreciate it.
Sure, thank you.
very good. There was another question about the newsletter, how to receive the newsletter, but Justine's going to put
Yes.
that in the chat so that anyone who wants to receive that, they can certainly sign up to receive that.
Exactly.
I know Ms. Myers only has a few more minutes, so if there's no more questions, I will just thank Ms. Myers and AARP for participating today in our series and our workshop. So much information, so much good information on what you all are doing throughout the state, and looking forward to how you all can continue to provide that support here in the upstate as well. So again, thank you so much for all you're doing, helping our seniors, and thank you for everyone here that's actually doing all they can to help seniors in our community. I will now turn it over to Ms.
I was just saying thank you, and my phone number is there, and Justine, of course, has it in my email. Feel free, if you didn't get a chance to ask a question or have some additional questions, feel free to follow back up with me. And Mr. Bennett, I want to say to all of you, thank you so much for your patience. Now that my presentation is finished, my lawn service has ended, my sound is great.
It all works
Thank
out.
you.
I'm just so glad we have survived this. Thank you.
Thank you so
Thank
much.
you. Ms. Doreen, we're going to ask you now to come on and talk a little bit about what you all have, your efforts going on at the Appalachian Council of Governments.
Good morning. Can everybody hear me okay?
Yes.
Okay, great. We are working really hard, harder than what we normally would, because we are still kind of working out of office. Our building is not open to the public at this time, and we are only working less than half capacity of staff in the building. So we are working remotely from home. The COG made sure that once they shut our building down, they made sure that we all had all the materials we needed to work to make sure we were serving our seniors without a hiccup. And I'm proud to say we have been doing that. And I'm going to go on with our nutrition program right now. Just last week, Tim had informed me that they served over 8,000 home delivered meals in the upstate.
Wow.
Which is more than what we ever have done. It's because of the funding that we've gotten from the CARES Act and the Family First Act due to the coronavirus. So we were able to, and we're still able to, serve that many people. However, Tim was telling me that we're almost exhausted those funds. So we need Congress to continue fighting and battling to get those funds going so we don't have to shut anybody off. Congregate sites, we have 3 sites that are looking to reopen in September with limited occupancy, which will be through reservations only. So that will be good. You know, we're just trying really hard to get back to somewhat normalcy, if you may, but we're trying really, really hard. Our assessment department, we are averaging 500 assessments a month right now. We used to do typically 400. That's when our assessors would actually go out into the homes, do face-to-face assessments. Again, due to the coronavirus, we're unable to do that right now. So they're doing over-the-phone assessments, which is enabling them to do many more now they're not traveling. And the word is getting out, that, Appalachian Council of Governments is there. So a lot of people are calling in to be assessed for different types of services. Our medical transportation, minor home repairs, homemaker services, we still have a lengthy wait list going on with that. We're doing the best that we can with the funding that we have, but we're making it happen. Like I said, the assessors are still very, very busy. We're all very busy. As for the SHIP program, they are working from home. Open enrollment is going to begin on October 15th through December 7th. Tim informed me that the SHIP counselors will be in the building during that time, but they will not be having any walk-ins. Like in the past, we would have people come in to do the actual enrollment, but we will not be doing that. So it'll be all over the phone, which hopefully with that going on, we'll be able to do more than what we do, because when they're coming in, it takes more time to do those applications and things like that. So they'll be busy taking care of that. Our SHIP program also partnered up with South Carolina Thrive, which means what we're doing now is we're able to assist clients into applying for community long-term care. We were not able to do that before, but that's something that we're doing now. So that's a really big help. So when we have clients that we're talking to over the phone and we see that they might be eligible for that, now we're able to say, you know, one of our SHIP counselors is able to help you get that application started. So that's a great program that we just started. Our family caregiver program is still, you know, business as usual. They're moving right along. They have another program called Seniors Raising Grandchildren program. And they just recently served 9 families in the upstate with these really neat camping baskets. They were filled with age-appropriate games, snacks, South Carolina park passes, and a list of things to do for the grandparents to take those kids out to different areas in the upstate that's free or, you know, little charge. So they really, really enjoyed it. There was teddy bears, all kinds of really neat things in these baskets. So we were glad that we were able to still, you know, do something like that for them. In our ombudsman program, they're busy, busy, busy with all of their, you know, concerns that they're trying to investigate. However, it's more difficult because they're not going into the nursing homes to be able to do those investigations. They're doing them over the phone, video chats, you know, whatever way they can. Pressure is on with the families, constantly calling, you know, when can we get in? But that is also being worked on. We have a task force now, which Tim happens to be on. Tim Womack is on that task force to try and get the nursing homes open. So then the ombudsman can actually get back into the facilities with those type of complaints. So there's a lot going on. We, like I said, we are busy. We're working. I'm proud of everybody there at the COG. They're working so hard, but we're making it work, and we're making our seniors, you know, giving them the ability to, you know, obtain the services that we can.
Well, thank you so much for the update. I know you all are working hard and working through, doing all you can to continue to help and support the seniors in the community. And we just really appreciate what all you do for the community. Justine, will allow you the opportunity now to just kind of talk through some of the programs, upcoming programs from 10 at the top.
Ooh. Hi everyone. I'm not really new anymore, but I'm new to you. I started with 10 at the top at the end of March, and we like to laugh about how I came in and I picked up my laptop and I signed my paperwork and then I went home. So we worked from home for quite a while, and we're back in the office most days now. We have a small staff here, so we can be socially distant. So I just wanted to give you a little update on what we're doing. Even though it's a pandemic, we're still as busy as ever. I'm familiar with the work that you all did last year on compiling some information, getting together and determining some important points, and that it was determined that a support document was needed with some data. So we are still working on that. We also have several other initiatives that are still going gangbusters over the Zoom. Our entrepreneur ecosystem has been meeting. Our Upstate Professional Planners Group is working with a Clemson graduate student. He is going to compile all of the upstate's comprehensive plans and review them for things that they have in common, things that they don't, ways they can work together. Teach at the Top is still happening. That is basically, it's a website that I'm working on. I think we all are familiar with teacher shortage here in South Carolina in the upstate. And so what we're doing is developing kind of a portal that will help people who are interested in becoming a teacher do that easily with all the information that they need at their fingertips. And then we did have our peak event planned for young professionals this fall, which we've postponed till the spring, but we're doing a series of sneak peeks virtually monthly for our young professionals that are kind of designed to be fun, but also educational. Of course, we have our chats, which I know not most of you, many of you have been on, just keeping our stakeholders updated every couple weeks. And then something that's a little bit new is creating a safer upstate. We've been getting together with law enforcement officials, businesses, community leaders to talk about how we can set up some planned strategies to make the upstate the best it can be for our communities. So I did put my email on the screen there. Feel free, that was a lot of information. Feel free to email me if you would like any more information about those initiatives or anything else. And our next meeting is scheduled for September 29th, and we'll talk about seniors and technology, which is going to be really interesting, I think. That's it for me. Thanks so much, James.
Well, very good. It sounds, from the sounds of everyone's talking today, is a lot going on everywhere. And so this shows the resiliency of our community and all the organizations to do all we can to continue to support and help our seniors in the community and helping them get the essential needs so that they can continue to age in place and live out their lives with dignity. So again, we thank everyone for participating today. We'll look forward to seeing you all when our next meeting on September 29th. I'm sure I ask that you be on the lookout for any communication from Justine, and I ask that you please do register for that to hear more about seniors and technology. So again, thank you all. It is approaching right at 11 o'clock. We try to keep it right at an hour or less. And so we want to keep our promise. And so again, thank you again for participating, and we look forward to seeing you next time.
Thanks, everyone.
Thank you for coming.